There is an obvious epidemic with substance abuse, with opiates and pills in the community. Statistics show, and I just read one recently that said that 1 in every 12 high school students have taken a pain pill for other reasons other than medical reasons. And then 70% of them got them from households. Mm-hmm. So if we can get them out of the houses and the homes, it's less likely for a child or a teenager to start taking them from medicine cabinets and their parents. We have 2 locations here in Greensboro. The first is our substation on South Swing Road, and our second is our eastern substation on Maple Street. And all you have to do is bring the pills with you, and you can drop them in the box. It's anonymous. We don't know, or do we care who's dropping them in the boxes? The only thing we do ask of is no syringes, no liquids, or anything that can harm a person that's empty in the box. And of course, no illicit or illegal street drugs as well. It's especially important to dispose of pain medication and over-the-counter medications. Anything that you get by prescription, per se, is great. These boxes can handle them and we can destroy them properly. The pills are properly disposed of with several regulations. We seal them as soon as they're emptied out. They are sealed in a box, they are weighed, and then they are incinerated, just like our additional evidence that we get off the street. Get the pills and the drugs out of the homes and properly disposed of, I think it will directly affect the community. And anything that Greensboro Police Department can do to directly affect the community is a win in our book.
Project Lazarus was started in Wilkes County when they were one of the worst counties in the nation with overdoses and deaths from prescription pain medication. And the project was so successful, it was looking at a way to how to get it across the state. And one of the ways to do that was to take it into Community Care of North Carolina, because they have 14 partnerships. So 2 years ago we took it in and called it the Chronic Pain Initiative, and last year adopted Project Lazarus name and took the tool, and now we're tailoring it to the needs of each individual community in our network, which is 3 counties of Rockingham, Guilford, and Randolph County. As Officer Block said, the numbers are astounding when you start looking at the statistics of 11.7 deaths per 100,000 people. When a county like Guilford County with approximately 500,000 people, those numbers are high. But for every 1 person that dies, we've got approximately 1,000 people that are using these medications, abusing these medications. And so there's potential for more deaths, more overdoses, which means more ER visits, more of our EMTs, first line folks going out to homes, businesses, schools due to these overdoses. Mm-hmm. Here's some of the things we're trying to prevent. Mm-hmm. Don't share your medication. Sharing your medication is dangerous because we as Americans, we want to help each other. And when someone says, my back's killing me, and somebody, well, my doctor gave me this, so here, try it. You know nothing about the person. They could be allergic to the medication, they could not tolerate your dosage, you could have an overdose or possibly an overdose and a death. The other thing is take your medications as they're prescribed. We also like to self-medicate by saying, well, 1 pill doesn't work anymore, so I'm going to take 2. What is your body tolerance? You don't know that. If the pain is still there, please consult your physician and get the good professional help that you need, and don't do it yourself. Disposing the medications, that's what this program is really all about, is we want to get the medications out of the house, off of the street, so that we can reduce these numbers of overdoses. One of the things that wasn't mentioned before is people break into other people's houses and they'll steal their medications. Mm-hmm. Tragically, folks have, when they go to funerals, you've got these signs up in front of your house saying that there's been a death in your family, big wreath on the door. People will scope this out and break in your house while you're going to bury a loved one and steal medications. So this is how huge this problem is in the community. I personally want to thank Greensboro Police Department for wanting to take this on, because this is an additional duty. There's no statute, no mandate, nothing coming down saying you have to do this. They just realized how big this problem is on the street and decided they got to do something. So when we got together and we started having this nice little relationship of we need these boxes, we need to start getting them in place, they decided they wanted to start with 2. what they're going to find out, I'm sure, is it's going to be absolutely overwhelming in a short amount of time, and hopefully they'll want to get a couple more put in other places in the city, so that it's more accessible to more of folks in Greensboro.
Because it gives us an opportunity for people to have other places other than our national medicine drops to leave their unused medicine. And it takes it off the streets, it gets it out of the hands of teams, and it's something that we really welcome in this county.